CicuDevices.
CICU Challenge. Spike in the purge trend. First of all, more videos like this can be found in the CICU Challenges playlist. A 65-year-old male with cardiovascular risk factors including active smoking and occasional use of cocaine. He had a documented allergy to penicillins. In the months prior to the current evaluation, he reported experiencing exertional chest pain. On the day of admission, the patient experienced an episode of oppressive chest pain, lasting approximately 8 hours, prior to presentation to the emergency department. Following electrocardiographic evaluation, an urgent cardiac catheterization was indicated. In the catheterization laboratory, findings consistent with cardiogenic shock were identified, including tachycardia, hypotension, and an arterial lactate level of 3.2 millimoles per liter. The decision was made to proceed with Impella implantation, followed by percutaneous coronary intervention to the left anterior descending artery. The patient subsequently stabilized and was admitted to the intensive care unit. During morning rounds the following day, review of the console data revealed a spike in the purge pressure trend.
What could be happening?
A purge pressure sensor dysfunction.
A purge tubing kinking.
A purge fluid leak. A purge bag change. A purge bag change. The apparent abnormality was ultimately attributed to the routine purge bag exchange process, which had been triggered as the purge fluid bag became depleted. The purge system is a critical component of Impella support, designed to maintain continuous fluid flow through the motor housing in order to prevent blood ingress, reduce the risk of thrombosis, and ensure proper lubrication and cooling of the device. A decrease in purge volume and interruption of flow may predispose to thrombus formation within the motor, potentially leading to device dysfunction or failure. Changing the purge bag is a routine procedure during Impella therapy, which is typically required approximately every 24 to 48 hours. During the exchange procedure, the controller automatically delivers a small purge bolus to maintain adequate pressure within the purge line, compensating for the temporary interruption of flow by means of the elastomeric reservoir mechanism. These transient changes in purge flow and pressure create a characteristic pattern in the purge trend graph if reviewed later. Specifically, a sharp rise in purge pressure followed by a sudden drop in purge flow can be observed. Both parameters normalize rapidly, generating a brief spike in the purge graph. This pattern should be recognized as part of the purge bag change procedure and should not be mistaken for a malfunction of the purge system, such as a kinked purge line. This finding in the purge pressure trend can be attributed to the purge bag exchange by reviewing the alarm history on the console. Typically, the exchange is performed following the advisory alarm, purge volume low. Once the purge bag has been replaced, the system generates a confirmation message stating, "Resolved, purge volume low." Additionally, the exact timing of the event can be verified, as the system log provides a precise timestamp, including date, hour, minute, and second. Correlating this information with the observed spike in the purge pressure trend allows clinicians to confidently identify the event as a normal consequence of routine maintenance rather than a pathological or device-related complication. Another distinguishing feature between a purge bag exchange and a purge line kinking event is the morphology of the pressure and flow curves when analyzed over a shorter time scale on the purge screen. In cases of kinking, the pressure typically shows a sharp increase, while the purge flow simultaneously drops. Once the obstruction is relieved, both parameters recover in parallel, returning to baseline values almost immediately. In contrast, the purge bag exchange follows a different pattern. Initially, there is a rise in purge pressure due to the bolus of fluid delivered into the elastomeric reservoir. This is followed by a transient decrease in pressure during the opening of the purge system for priming. Subsequently, pressure gradually returns to baseline levels. Notably, the purge flow curve temporarily ceases to display values during this process, reflecting the interruption in continuous measurement. Finally, flow readings typically resume approximately 30 seconds after completion of the purge bag replacement procedure. Further details on the purge bag exchange procedure can be found in our video on the YouTube channel titled "How to Change the Purge Fluid Bag." The link is available in the description.
If you've enjoyed our video, please press the like button and subscribe to support us so we can continue creating quality content like this.